Welcome back. A lot of parents are busy with those back-to-school supply lists right now, but don't forget there's also a checklist for many students when it comes to health exams and immunizations. We're pleased to welcome Dr. Carmel Wallace, Interim Chair of UK's Department of Pediatrics, with a look at some back-to-school medical must-haves. Thank you so much for being with us today.
Thank you for having me.
I think people get so preoccupied with all the supplies they need for schools. This may be something that kind of gets rushed towards the end of the summer.
Frequently gets put off to the end.
Not that, people are rushing to get immunizations either. So
Yes.
Tell us about some of the things that parents need to know about what they need for their children to attend school.
It's an exciting time of year, especially for the 4- and 5-year-old who's going to be entering school the first time. They've seen big brothers and sisters go to school. They sense all the enjoyment of it. They haven't been exposed to the work yet. But the state and the school districts require certain things. Probably the most important one is the school entry exam. Depending upon which school district, sometimes at least 6 months, sometimes 12 months before entry, the child has to have a special form filled out. That form it includes a brief medical history, goes through the physical examination, height, weight, blood pressure. We talk about school readiness. Check the child's ability. Are they really ready for school? Counting, ABCs, colors, shapes. And at that point, we start talking about immunizations. There are certain immunizations that are required by law. Most parents are familiar with the DTaP, the diphtheria, tetanus, nasocellular whooping cough. Excuse me. The IPV, the inactivated polio vaccines most kids have had much younger. They don't need one then. Most kids will need a second measles, mumps, and rubella immunization at that point. They usually had the first one sometime after they turn 12 months of age. In the last year or so, the chickenpox vaccine, the varicella vaccine, has also been a required vaccine unless the child has had a documented episode of chickenpox. Certain other series like the Hib vaccine and the Prevnar vaccine are pretty much younger, but that's a catch-up time if the child's not turned 60 months.
And we've actually seen some recent changes in the past few years of some of the requirements, I know, with eye exams and things like that. And so if you have an older child, be sure to double-check and make sure that you're meeting the current requirements, right?
Currently, an ophthalmologist or an optometrist is required to do an eye exam within 12 months of school entry, and a dental exam by a dentist or designated person for oral hygiene purposes. So those are sort of new to some parents. If you've got a high schooler, you may not have had to go through that when they were entering kindergarten and first grade.
And, of course, you can always check with your family physician, but you've got lots of resources with the American Academy of Pediatrics, the State Department of Education, and your individual school systems. But statewide, it's going to be the same. And if folks, for whatever reason, are abstaining for immunizations, what options do they have?
Limited. If it is religious, they can do an exemption. That's usually signed either by their minister or priest. If it is philosophical, that's a difficult issue, and they need to talk with their pediatrician or their primary care doctor about the possibilities of that.
Yeah.
Some school districts are very strict about it. Some are a little more liberal.
And as you mentioned, there are some things that are recommended and required. So talk to your doctor about what's best for you and your child.
Correct.
Well, thank you so much for being with us today.
You're welcome.
We will be right back with more news and weather after this.